Hi, my name is Sadie, and I will be introducing what congenital heart defects are and sharing the pathoflow of Tricuspid Atresia.
Hello everyone, my name is Trelessa, and I'm going to be talking about the causes and risk factors.
And my name is Rianne. I'll be talking about the evaluations to diagnose tricuspid atresia.
My name is Mariah, and I'll be going over therapeutic procedures and treatments.
My name is Apple May, and I'm going to be talking about the medications.
Hi, my name is Lester, and I'll be doing client education. And this is
Kiana Sue,
who will be focusing on clinical manifestation.
What is tricuspid atresia? Tricuspid atresia is a birth defect of the tricuspid valve. And as we learned in class, the role of tricuspid valve allows the blood flow from the right atrium to the right ventricle. Thus, this defect affects the blood flow of the heart, which affects the rest of the body. This defect can also be associated with atrial septal defect and ventral septal defect. As mentioned earlier, tricuspid atresia is a rare form of congenital heart disease in which heart abnormality is caused by early changes while the baby's heart is still developing before birth. The exact cause of tricuspid atresia remain unknown according to the Center of Disease Control. However, some babies who have heart defects are assumed to be caused by changes in their genes or chromosomes. In addition, tricuspid atresia has certain known risk factors. This includes contracting the German measles, also called rubella, or another viral infection in the first trimesters. Smoking and alcohol consumption during pregnancy, poorly controlled diabetes and diet, taking certain medications such as medicine that are used to treat bipolar disorders, seizures, and acne, and lastly, a history of congenital heart disease in a family.
When it comes to the clinical manifestations of tricuspid atresia, they're usually seen soon after birth and in babies. These include blue-gray skin and lips due to low oxygen levels, struggling breathing. The baby tends to get tired easily and even more so during feeding. The baby's growth is slow, and they have slow weight gain. Individuals who have tricuspid atresia also develop heart failure, in which these symptoms can include fatigue and weakness, dyspnea, edema in the lower extremities, sudden weight gain due to a buildup of fluid, and acystitis.
For evaluating tricuspid atresia, it could be either done during the pregnancy or after birth. So there's 3 types of ultrasound that can be done during the pregnancy. So first we have a standard ultrasound which creates 2-dimensional image. And second, we have a Doppler ultrasound where the movement of blood through the umbilical cord, the baby's heart, or between the baby and the placenta is showed. And then for the 3D ultrasound is a lifelike image of an unborn baby. After birth evaluation includes pulse oximeter that measures the oxygen saturation, auscultation wherein the doctor to listen to the heart sound. So heart defects would suggest murmur sound or swooshing sound. And as for cardiac catheterization, it is commonly used to examine the heart before an atresia surgery, and it is particularly for older children. For the doctor to rule out the tricuspid atresia condition, they might want to order some echocardiogram. So this would show the structure of the heart, holes in the walls between the chamber, as well as irregular blood flow. Then we have electrocardiogram, wherein it shows the electrical activity of the heart. And lastly, we have a chest x-ray, wherein it would show a slightly increased shape of the heart, right atrial enlargement, as well as decreased pulmonary vascular markings. In this slide, we have an echocardiogram as well as a cardiac catheterization picture. So for echocardiogram, this is an example of ventricle septum defect because there's a space between the left ventricle and the right ventricle. And then for cardiac catheterization, this just shows where oxygenated blood and deoxygenated blood can go through. And for this slide, we also have a electrocardiogram example.
There are many different types of surgeries that can be given for these patients, and the type of surgery is usually dependent on how severe of the case. The first type of surgery that they would get is atrial septostomy, which happens within the first days or weeks that the baby is alive. And this is when the doctors expand or open the atrial septal defect. And the atrial septal defect is usually a hole between the right and the left atria. Looking into banding, so a band is placed around to reduce that flow and that accumulation of blood that's entering into the lungs. So the next type of surgery is shunting. Is a procedure that is done within the first 2 weeks of the baby's life. And it's when a pathway from the aorta to the pulmonary artery is created. And this transports blood from the aorta to the lungs. The bidirection gland happens when the baby is 4 to 6 months old. This creates the connection of the pulmonary artery and the superior vena cava. And then there's the Fontan procedure, which happens when the baby is 2 years old. And this creates connection of the pulmonary artery and the inferior vena cava.
Tricuspid atresia cannot be corrected with drug therapy. However, some of the pathophysiological abnormalities are amenable to treat, and some functions can improve. Prostaglandin E1, also known as PGE1, is an intravenous medication that can keep the vessels open after birth and is used to manage the ductus arteriosus in neonates. Prostaglandin E1 will enhance the partial pressure of oxygen and delay the onset of metabolic acidosis by preventing the ductus arteriosus from shutting and restoring ductal patency if closure has already gone into effect. So the next medication is going to be digoxin, also known as lanoxin. This reduces the heart rate and enhances the blood flow to the ventricles by increasing the force of the heart's muscles contractions.
Here are the 5 key points for client education. The first one is lifestyle, such as adjusting feeding, staying active, and sports restriction. Breast milk is an excellent source of nutrition. However, a special calorie formula may be best if the baby isn't receiving enough nutrition from the breast milk. Giving the baby frequent small feedings is a must, as they may not acquire enough calorie with a regular one due to their body's constant fatigue and other factors. In general, physical activity is important for heart health. Encourage as much play and activity that your child can tolerate. Allow lots of time for rest. Secondly, their immune system cannot be compromised. Thus, parents should follow the standard immunization guidelines according to CDC. Next, coping and support. Talking with other people who've experienced the same situations may bring comfort and encouragement to each other. Sticking to a regular routine can also demonstrate coping strategies that help lessen overwhelming emotions. Fourthly, being organized and keeping track with your child's progression and records is essential. At least a yearly appointment with a pediatric congenital cardiologist must be committed. Keeping your child's health history and copies of surgery reports are also important. Lastly, the parents should be reminded that they are not alone. There are lots of offered resources and services that they should take advantage of. Being familiar with the different resources provided, such as therapists, counselors, support groups, dietitians, are beneficial.
Now I'm going to explain the pathoflow of tricuspid atresia. This is when there is a non-existent tricuspid valve and instead is replaced by a sheet of tissue that blocks the flow of blood between the right heart chambers, which leads to compromised blood flow in the right side of the heart, reduced blood flow from the right atrium to the right ventricle, and reduced blood flow from the right ventricle to the lungs. This can cause the blood flow from the right upper chamber to go directly to the left upper chamber. This can cause 2 different defects, which is a hole between the right and left atria, which is called atrial septal defect, or a hole between the right and left ventricles, which is ventricular septal defect. With those defects, blood can flow through the hole directly to the main lung artery, but too much blood going through the lungs can cause heart failure. With tricuspid atresia, the right ventricle may be underdeveloped as well as the pulmonary artery, and because of the reduced oxygenated blood, decreased atrium fill, there's a lack of oxygen to the body's tissues, which can lead to hypoxemia.
That would be all. Thank you for watching, and hopefully you became more aware of this condition.